Hi, I'm Garvin. This telecast is on Monotrim. So Monotrim, or the chemical ingredient Trimethoprim, is an antimicrobial agent. Trimethoprim has an effect on most gram-positive and gram-negative aerobic organisms, including enterobacteria such as E. coli, Streptococcus pneumonia, Haemophilus influenza, and Staphylococci aureus. Each tablet contains 100 mg of trimethoprim, and in the liquid each 5 ml contains 50 mg of trimethoprim. Treatment of infections caused by trimethoprim-sensitive organisms include urinary and respiratory tract infections and prophylaxis of recurrent urinary tract infections. Monotrim 100 mg tablets are not recommended for use in children under the age of 12 years. For the treatment of respiratory and urinary tract infections in adults and children over 12, take 200 mg twice a day for 7 to 10 days. The first dosage on the first day can be doubled. For the prophylaxis of recurrent urinary tract infections in adults and children over 12, the usual dose is 100 mg at night. An extra 100 mg may be taken in the morning if necessary. If using the 10 mg per ml oral suspension for the treatment of respiratory or urinary tract infections in adults and children over 12, the usual dose is 200 mg, which is 4 5 ml spoonfuls, twice a day for 7 to 10 days. For children aged 6 weeks to 5 months, you give 25 mg, which is half a 5 ml spoon, twice a day for 7 to 10 days. For a child aged 6 months to 3 years, you give 25 to 50 mg, which is half to 1 spoon, twice a day for 7 to 10 days. And for children 4 to 7 years of age, it's 50 to 75 mg, which is 1 to 1.5 spoons, twice a day for 7 to 10 days. For 8 to 12-year-olds, it's 75 to 125 mg, which is 1.5 to 2.5 spoons twice a day for 7 to 10 days. For the prophylaxis of recurrent urinary tract infection in adults and children over 12, the usual dose is 100 mg, which is 2 spoonfuls at night. Side effects of this medication may include nausea, sensitivity to light, or skin rash. This medication should not be used during pregnancy. Let your pharmacist or doctor know if you are breastfeeding. You must also inform your pharmacist if you have problems with the way your kidneys work, or if you've ever had an allergic reaction to a medicine. Also, tell your doctor or pharmacist if you're taking any medication, especially folate antagonists, anticonvulsants, phenytoin, digoxin, diuretics, cyclosporin, ACE inhibitors, estrogen, or anticoagulants. The use of medicinal products known to cause hyperkalemia with trimethoprim may result in severe hyperkalemia. Therefore, special monitoring of serum electrolytes should be performed in patients due to risk of hyperkalemia. Blood glucose should be monitored if used concomitantly with rapaglinide. Trimethoprim may cause a depression of hemopoiesis. During long-term therapy, hematology should be monitored regularly. Particular attention should be paid to patients showing a tendency to folate deficiency, which may be aggravated by the use of this product. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's pharmacy in Cork. Thank you for watching and have a nice day.